Hello, Dr. Jeneb here from Heart-Based Medicine. This is the third in my series on menopause. What I'd like to talk about is different treatment methods for menopause. Now again, as I said, some women don't need any treatment as they go through menopause. It happens very natural for them. They don't have any symptoms and they just go through without really a blink of an eye. They don't need any treatment unless there's some underlying causes that are there, which we'll talk about in a moment. Other women, as I talked about in my last video, can have a very rough ride through menopause. They can have a lot of emotional issues come up, the hot flushes, the lack of sleep, their periods may get quite heavy. They might have very frequent periods, which can cause iron deficiency for them. Lots of things can happen during this time. And again, there are lots of treatments out there that can help depending on what your symptoms are. When I see someone for menopause, the first thing I always do is I go through what the symptoms they're having are, because the treatments can be different for the different symptoms. One of the things I didn't talk about in the last video was, of course, the weight gain that can occur during menopause. Now, we want to look at that weight gain as our body actually trying to help us. So what occurs is our body's trying to continue to make estrogen. And the only other thing in the body that makes estrogen is fat cells in the belly. So all of a sudden the body starts to put on weight in the belly. It's actually our body trying to help us, trying to make estrogen for us. But of course, we all get a little freaked out about it and we want to get rid of that weight right away. So that's probably the one thing in menopause that's probably the hardest to treat. And one of the ways I have found to treat that is working with a ketogenic diet. Check out Mindy Pell's. She does those fasting like a girl and a lot of great menopause information. Great information on diets for menopause from her. Different ways you can work with it, different things, seed cycling, etc., etc. For other symptoms of menopause, again, there's a myriad of ways that you can treat it, and how you treat it depends on the symptoms that you're having. Things like kinesiology is very good for balancing hormones. Acupuncture, excellent for working with hot flushes and some of the other issues with menopause. Things like herbals and homeopathics and Chinese medicine, all of them work beautifully for many of the symptoms of menopause, the hot flushes, the mood swings, the irritability, the sleep. Those can all be handled very well through herbal treatments with your naturopath, your homeopath, your acupuncturist, Chinese medical practitioner, and Ayurveda as well. Again, a holistic GP can also help you with some of those things for that journey and for helping you with the journey. Then we go to things like hormone replacement therapy. Now, there are two different types of hormone replacement therapy. There are the bioidentical hormones and there are the pharmaceutical hormones. It's kind of how I differentiate them. So the pharmaceutical hormones are getting closer and closer to the bioidentical hormones these days. So the main difference between them is how we can dose them. And also with the bioidenticals, you can add in things like testosterone, pregnenolone, DHEA, other things that you might need, other hormones in the pathways that you might need. Estrogen comes in, well, estrogen gets broken down from E1 to E2 to E3. Originally, our pharmaceutical menopause medications were made out of E1, the Premarins. That is the most cancer-causing estrogen that there is. E2s and E3s are less carcinogenic, though we don't really have any research to say how risky they are. And I always tell all women who are put on HRT about risks of breast cancer with estrogen and potential risks of uterine cancer as well with estrogen. For that, we always give you progesterone to balance that out. Now, each hormone does something different in your body, and which hormones you need somewhat depends on which symptoms you're having. It is useful to use, if you're going to use a pharmaceutical one, to use something that's topical because it doesn't then pass through the liver. You don't get some of the side effects that you do and difficulty with the estrogen breaking down in the liver by using the patches or the creams. Now in Australia, where I'm based, it's somewhat difficult to get patches at times and somewhat frustrating for women. And it's okay if you go on the orals off and on, but again, I prefer patches and creams just because you don't have that breakdown in the liver and that pass through the liver. When you use the bioidenticals, they come as either cream or troches. Troche is a little waxy tablet that goes up in your gum and gets dissolved, again, bypassing the liver breakdown of the medication. You can use lower doses when you're using topicals medications because it doesn't have to be broken down. So with a bioidentical, like I said, you can put testosterone in it. Testosterone for women has a lot to do with our sex drive. It does drop as we go into menopause, and it can also have to do with our muscle strength. Now, using testosterone can lower your voice, it can increase hair growth, so you need to be careful with testosterone. But I don't shy away from using it, just lower it if people are having troubles. DHEA is your precursor to testosterone. It helps a lot with energy levels. It can help, you can actually use it vaginally as well. It can really help with your vaginal mucosa. I like to use DHEA a lot, especially in women who have a lot of fatigue or who have a lot of trouble, but we really are a little cautious of using estrogen in them because they have a strong family history of breast cancer. Again, progesterone, really good for mood. Estrogen, really good for the hot flushes. But they all, you can't really tease them out because remember, the body uses everything as a whole. So there are many, many ways of treating menopause. Again, it depends on your symptoms. It depends on how difficult your symptoms are and the journey that you're having through it. Again, I said there are some caveats where I might use hormone treatment in women who aren't having any symptoms. Those would be women who have low bone density because we know that continuing hormone therapy helps the bone density. There might be women who are having some sexual issues even though they aren't having the other symptoms like hot flushes, etc. We used to think that using hormone therapy in women really helped prevent cardiovascular disease. We know now that that may not be so true, but we do know that hormone therapy actually can help prevent some other things. So stay tuned, we'll continue to talk about menopause, and thank you for joining me.